Any exam cannot judge a student's capabilities. What we study for the whole year, it can't be judged in 3 hours. More than 5,000 patients are waiting for kidney transplant. They are registered with me, and more than 1,000 patients are waiting for liver transplants. So this is the requirement of the day. More than 70% of the people in this state are like they are below poverty line. So we have to take care of their interest. I always think of them. I'm not against any private hospital, any corporate culture, but you see, when you are given targets to do things, and when you're not meeting your financial target, you are forced to do things which are not ethical.
Every meaningful change begins with a simple question: how we can make life better for more people. In this episode of Expressions, we have Karnataka's Minister of Medical Education, Dr. Sharan Prakash Patil, sharing how healthcare, education, and compassion can come together to shape a better future.
Hi, welcome to Expressions. I'm Neha. Today I'm joined by someone really special. Let's get to know about him and his journey, and let's learn from him too. Thank you so much, sir, for joining us today. It's such an honor to have you on our podcast.
No, it's a pleasure always talking to Indian
Thank you so
Express.
much.
Yeah.
I want to start by asking you that you visit government hospitals unannounced. So, as a doctor, what's the first thing that you've noticed which a non-doctor minister would, never think about? And also, what's the one standard you refuse to compromise on?
You see, always when I visit a hospital, what I notice is whether these patients are being attended to or not, and how much is the time it is being taken for them to be consulted. And always we inquire with them that whether they have been treated well, whether they have been taken care of, or any hardship they have come across, or is money being asked to them. Because when I go to a government hospital, we expect everything to be free of cost. So these are some things I ask them, because you see, whenever a patient goes to a government hospital, he goes with a great expectation. And the people who are visiting government hospital are probably the ones who can't afford to go to a private hospital. So it is a responsibility, I always feel it's a responsibility of the government to take care of them well. And it should instill confidence in them that whenever something happens to us, there is a government hospital to take care of us. So that confidence is required.
Absolutely, sir. And when did you last write a prescription and do you miss it?
Oh, that was very long back. You see, I incidentally joined politics, but even though I had a political background, my father was a freedom fighter, and he was in public service. He was in Congress as well, and we had a constancy. But just because our constancy was reserved at that point of time, my father could not become MLA.
Okay.
And later on, he was a president of that taluk for a long time.
What
I
was his
had a
name?
political background. His name was Rudra Patil.
Okay.
I had a background, but I had not thought of coming to politics. And even my father didn't know that in his lifetime. He unfortunately passed away in 1992. We were not, none of my brothers or nor me, we were not much actually involved in any political. I was my postgraduate at that point of time. I had just passed my BBS and I was about to join post graduation. Then after my post graduation, I thought of joining politics, and then I became Youth Congress president. And then I was working in a medical college, even that at that point of time, as an assistant professor. That was that when I had prescribed. That was I worked for 5 years there. Then I contested for Jila Panchayat in 2000, and was also elected, and I was vice president of Jila Panchayat for 20 months. And after that, I became a legislator in 2004.
So, sir, is this your father's dream or is this what you always...
Of course, it was my father's dream.
Yes.
Yeah, he was like well-respected politician in my taluk. And I always feel just my father could not become MLA and I have become one.
Yes, sir.
Because of the service he has rendered to the people.
Yes.
And he was involved in freedom struggle as well. So had a very good name.
Yes. I'm sure he's very proud of you today. So, sir, you once told this newspaper that your most embarrassing moment was when you were caught bunking PU classes to watch movies. So now, the boy who once bunked, you're heading such an important position in the government, Karnataka government today. What do you feel and how do you feel about that?
Yeah, you see, we were friends. You see, every student has this moment in his life. In Pew College, in high school as well, used to sometime bunk class and go to his movie. So definitely, you see, those were the days, carefree days as a student, even in a medical college as well. As a student, you have no responsibilities. Only thing is you need to study, and then you are free and you are with your friends. So they're very good moments of your life. What I would say is all students should enjoy their life as well, apart from studying.
So that you have stories to tell, no, sir?
Yeah, of course. And you see, nowadays, what I have found is like when we were students, we used to enjoy a lot, and our group of our friends were like very lively. Nowadays, you see what I see in medical colleges, most of the time they are all the time studying
Yes,
and no
sir.
fun at all.
Yes, sir.
This is what we have seen in recent times.
Absolutely.
They
So
are
much stress, competitions.
yeah, it was not so in nowadays like it was not so like competitive or students were all carefree. They used to study, but in the meantime, they used to give time for other sports and other cultural activities as well.
Okay. So also you came from
Udagi village.
Udigi, yes.
My village name is Udagi.
Yes.
It is around 6 kilometers from Sedam, which is a taluka
Yes,
headquarter,
sir.
which is my constituency in Gulbarga district.
Yes, sir.
That's on the border of Telangana.
Okay. So suppose today a farmer's daughter from Sedam wants to become a surgeon as easily as you became a doctor. What still stands in her way and what are you doing about that?
You see, my first thing when I became a medical education minister in 2013, when I was like called for a discussion by the finance department and chief minister for what should be the plan for the year. So first thing I proposed was we should establish a government medical college in each district. They asked me why, because there are so many medical colleges already in the state. Why do you want to start government medical college in each district? My answer was, you see, if you establish a government medical college, all the seats will go to merit quota. And in each district, there will be a teaching hospital attached to a medical college where there will be all faculty. So it will be a shelter to a common man. And you see, our students across the state, they strive so hard to become a doctor. So to take care of the interest of the meritorious students. So if a common man's daughter or a son should become doctor, so a farmer's son can become a doctor only if the merit quota swells, not the private quota.
Yes.
They can't afford that.
Yeah.
So that is why we have started the journey of establishing a government medical college in each district. Now we have crossed a huge path. Now we are having nearly 22 government medical colleges, and we are also setting up 4 more in the coming 1 or 2 years. So this has definitely been a great step towards that.
Yes,
My
absolutely.
intention was that people from the rural background, people from just like farmer's son or any commoner can become a doctor. That happens only if there is a huge number of seats in a merit quota. So that was the intention, and we have been successful in doing that. And I'm very glad to say the Karnataka is number one in the field of medical education today because of that decision, and we have highest number of seats in the country, and my state is number one in medical education in the entire country. Actually, whenever there was a discussion of health department in assembly. Most of the time, the topic was there is no doctor in my PSC.
Yeah.
In my PSC in Hobli place, there is no doctor. So I thought, why, in spite of so many medical colleges, why there are no doctors? Because you see, if government medical colleges are there, people from rural background come and study and become doctors. They will go back and practice. So that was the intention as well.
So, sir, a 17-year-old in Kalaburagi missed a medical seat by 5 marks this month. She's watching this, not as a minister, but as a doctor who once sat in the exam hall. What do you have to say to her?
You see, definitely today, this career, this is the most sought after career. Imagine we have 128,000 medical seats, like 1,28,000 seats, and 23 lakh students writing the exam. Can you imagine?
Then,
It's 1 is to 23, the ratio of what the competition is. In spite of that, you see, now I would like that girl not to get disheartened. You see, there is always a second time. You try harder, you will definitely. Perseverance is what commitment and perseverance will help you reach the goal. And apart from that, you see, the system what we have evolved, the country has evolved is NEET exams. It is not always like, I always felt that it is not rural friendly as well. You see, and NEET is a, we have, it was required and it is adopted because the merit should prevail. It should reduce the hardship of writing multiple exams and all this. There are good parts of NEET as well. But in the meantime, see, there are also like flip side of that, that you see people at in a rural place who have no access to good coaching classes.
yeah.
And there is a lot of difference in quality of teaching in metropolitan cities and in rural places as well. So this, yeah, I like in taluka places and even district places. The students are at disadvantage from a rural area. So that's why they are all migrating to the city to get better coaching classes. So this definitely has a challenge. We're trying to work on it.
Yes. So, one exam, like you mentioned, NEET, one score, one chance. Can a single number even measure a future doctor's heart? What did your entrance exam fail to see in you?
You see, definitely any exam cannot judge a student's
Yeah,
capabilities. You
I
see,
think so too.
what we study for the whole year, it can't be judged in 3 hours. So definitely, what we knowledge we acquire in our entire 1 year or 1.5 year of that year, either being PUC or 10th or even in medical college, it cannot be assessed by an exam in just 1 or 2 hours or something like that. But still, we need to have a system where like we need to know at least that the student has a minimum knowledge. So definitely there is a thin line. So, but still, I would like my students to understand that we have to go through this grill anyway.
Yes.
So better be prepared, well prepared for that.
Yes, sir. I understand what you said. You explained it very well. Also, so just days ago, America announced its medical students must study 40 hours of nutrition because their doctors were learning barely 1 hour a year about food. I mean, this was the recent news. So, our grandmothers always knew ragi, millets, and they were like medicines in our generation, in our time. So, in your MBBS days at MR Medical College, how much were you taught about what patients should eat? And did modern medicine forget food and can Karnataka bring it back?
Yeah, definitely. This you see, this study of allopathy is more like how the body functions.
Yes.
You see, we have a different subject like anatomy. We study where the body part is, how it is aligned. Then in physiology, we study how it functions.
Yes.
Then biochemistry, what are the chemical reactions happening in the body. So similarly, like when we study different aspects in allopathic this thing, this is mostly disease centric. You see, whenever we come across some challenges, like so how to deal with it, disease and its treatment is what we are focused on. But definitely, you see, the times are changing.
Yes.
With time, so many and with the technology has improved, and our knowledge has improved. Now we see we have migrated from communicable disease to non-communicable disease,
Yes.
which are very dominant nowadays. You see, earlier the biggest challenge was communicable disease. Now it is not so. It is a non-communicable disease which has taken over. You see, lifestyle diseases are the most focused ones now because lifespan has improved, and our with better antibiotics, with better improvement in science. There is so much improvement, but still there are challenges. You see now there is like lot of other things which what you mentioned. Just nutrition is important. Then prevention is always better
I
than
was just going
cure.
to say that, yes.
So always we need to focus more on that. You see our curriculum, which is like I cannot like impose things because in medical education curriculum is like by NMC. So, but still, we can always in the state we can say that preventive measures and lifestyle diseases how it can be avoided. So that can only be done by healthy living, like right eating, right and focusing on more exercise, physical activity. Now this is the biggest. You see, sitting is like smoking now. Apart from all the other bad habits like sedentary lifestyle is taking the toll.
Yes, so
So these are things we need to uprise our youngsters. These are the more challenging things in future as well, like addiction, more to nowadays. Yeah, not to substance, other than substance, more to this mobile and this thing. So these are the new challenges. Definitely, we need to teach our youngsters. We'll focus on that.
yes. Because movement is medicine, sir. Do you think so?
Yeah,
Movement. And also, sir, how do you stay fit?
me.
Yes.
You'll be surprised to know. I work out. I am like I have been always, though I'm diabetic, I always maintained my this thing by earlier. I used to. I'm a very good swimmer. Like I used to swim every day, and after that, like I was doing yoga for a long time, and now I have shifted to strength training.
That's
I
wonderful.
do strength training minimum 4 days a week, and I do.
Thank you for sharing, sir. That is wonderful. So we teach our MBBS students anatomy, surgery, all of what you mentioned. But who teaches them kindness?
Yeah, that's what I always tell my whenever I go to any of these graduation days. You see, not what you knowledge plays an important role. I wouldn't say it wouldn't, but still, the compassion plays a very important role. And most what I have observed, the students who are the backbenchers, who are not so good in the subject, they have become more successful doctors because of their attitude, because the compassion they show to the patient, and also the confidence they instill in them, and the way the positive vibes they give, and the concern they show to the patient, and their communication skill, that plays a very important role rather than your subject. You see, you know you are the best, you are the topper, but you don't speak properly to a patient, and you don't instill confidence in him.
Yes.
However good you might be, that he will not connect to you.
Yes.
But if you speak to him very kindly, if you make him feel comfortable, and if you make him feel that you are his concern is your concern, and you are going to take care of him, whether he has money or not, that will earn him a client
Yes.
lifelong.
Yes.
So that is very important. That nowadays students are realizing it. It's not because it's a very competitive world now. Now even in doctors, earlier it was like there are few, but now because of proactiveness of the government as well. So in as per the WHO standard, 800 doctor per population is what they have prescribed. Now we are already achieved that.
Wow.
In Karnataka, not only in Karnataka, in other parts of the country as well, there's medical colleges have started now. Earlier, when we were students across the country used to come to medical colleges in Karnataka.
Yes, sir.
What we can say is Karnataka has been fortunate enough to have leaders who had a foresight. Today, what is Bangalore, a Silicon City, because our elders established so many, not only government, but they allowed private colleges to be established in professional courses as well, in medical colleges, engineering colleges, were established. So we are now well ahead of other states. Now all other states are doing that, but we have that advantage. So talent pool in Bangalore is because of that decision. Now I always felt,
Yeah.
and quality education institutions which have been set up not only by the government but in the private sector as well.
Yeah.
So that's a great advantage.
Yes, absolutely, sir. I'm just feeling that Karnataka is in best hands whereas medical education is concerned.
Yeah.
If you could add one chapter to every medical student's education tomorrow, nutrition, compassion, communication, anything, what would it be and why?
You see, it would be definitely communication. What we are lacking today is what we do and how do we communicate with them.
Yes.
It's very important, and all this violence or it is because lack of proper communication to the patient.
Yes.
You see, whenever a patient comes to a doctor, you speak him well, you apprise him well, what is the situation, and at every step, because this has been I have been observing, as and when you explain it to them that this is a condition, these are steps we are going to take, and this can be the outcomes.
Yeah.
So definitely they will understand. But what our doctors most of the time they do is they treat them,
But they don't
but
explain.
they don't explain it to them. They don't feel it is required because they don't
Yeah.
understand. It's not so.
And
You see
that's not
nowadays,
reassuring, sir, for your
yeah.
patient.
You see, otherwise the family members they will be so anxious. If you don't communicate to them properly, definitely it will be snowball into some issue if outcome is not good.
Yes, sir.
So, but if you explain it to them in every step, they'll definitely understand it.
Yes.
So communication is very important. That's why I always tell my staff to tell that communication is the most important thing, and compassion, of course, it does.
Play a big role.
Yeah, it does play a big role.
So 4,000 crores, 75% free beds. Take us inside the first meeting with the Azim Premji Foundation. What did they ask you?
Yeah, you see, this is one of the big steps which is happening in Karnataka, that corporate sector can invest in public hospitals. That should be the goal. So we tried and we succeeded in that. And I should thank Azim Premji Foundation for having taken up this. You see, this idea actually crossed my mind when one Dr. Nagesh, he's a gastroenterologist, he came up with an idea in my earlier term, because I have been Minister for Medical Education for 8 long years now. I have that advantage being a doctor myself
Yes.
and walked this path. I know how this department functions in and out. So in 2016, I believe, he came up with an idea that why can't we establish one institute of gastroenterology where liver transplants can be done. You see, back then, even now, the liver transplant is a very costly affair. It's not, no common man can afford. So why not in the government sector? So this was the idea mooted by him, and we worked on that. And fortunately, our earlier chief minister also supported that. We established one Institute of Gastroenterology, which is working very fine,
Okay.
and where liver transplants are happening free of cost. Nowhere in country it's happening.
Yes, that's unheard of,
Yeah,
sir, actually.
it's happening in Karnataka, free of cost. We have Institute of Nephrology where kidney transplants are happening free of cost, but liver transplants were not happening.
Yes.
Probably this is the only institute where it's happening free of cost.
Where is this, sir?
That is in Victoria premises.
Okay.
We have an Institute of Gastroenterology. So when we had a discussion on this, and actually he moved this proposal, and he went and met Azim Premji Foundation. We had a discussion. What we were thinking was we should establish a bigger hospital. I allotted in 2000, not now, in 2017 when I was a minister, I said that this hospital, even though it is a 200-bed hospital, is not enough. We should establish a big one. So I unmarked 10 acres land next to that land. We had a land that next to Nimhans.
Okay.
We had an institute of Rajiv Gandhi chest disease. Under that, we had around 30 acres. I unmarked 10 acres for organ transplant, especially liver and kidney. So we unmarked that 10 acres land. Then we had actually we wanted to construct one 500-bed hospital on our own. But then we thought whether will it be able to sustain it in a long run, because this is a very costly affair.
Yes.
And then we thought of doing it a PPP model. Then he approached Azim Premji Foundation and said that we'll give you land. We gave this proposal. We give 10 acres land. It's very prime land.
Yes.
So you can establish one transplant hospital, especially super specialty hospital, where transplant facility is there for both kidney and all organs. And it should be free of cost for philanthropy. We were thinking in this direction because now you'll be surprised to know that more than 5,000 patients are waiting for kidney transplant. they are registered with me, and more than 1,000 patients are waiting for liver transplants. So this is the requirement of the day. So we requested them. We want to do it on our own, but we have a this finance department is now like telling, will it be sustainable? Then we thought of a PPP model. Some people had approached us. We had given a condition that you can establish your own one, and one should be for free of cost. So always my intention will be, like my target will be like more than 70% of the people in this state are like they are below poverty line. So we have to take care of their interest. I always think of them. So we wanted to establish one hospital where it should be free of cost or minimal cost. It should not burden them.
Yes.
So we mooted an idea and they agreed, and they are investing nearly 1,000 crores for that, and they have also agreed to run it, spending around 300 crores every year. We told them, and it will be named after them, Azim Premji.
Wonderful, sir. So, around the world, young doctors are walking away from public hospitals. What do you say to young MBBS graduate who asks, sir, why should I stay in a government hospital?
Yeah, this is a good question. Now this question was not relevant today, because I would have agreed if you had asked me this question some 15 years back when I was a minister in my first term. Now this thing has changed, thinking has changed. You know why? You see, now I have started establishing super specialty hospital in government sector. So my focus is to establish public hospitals. Why? See, now the culture of this corporate hospital has saturated, and people are not finding it so exciting now. Young doctors with bright minds,
Not fulfilling, also.
not fulfilling, because they are not having that kind of patient there.
Sure.
This is one. And though they are being paid well, I'm not against any private hospital, any corporate culture, but you see, when you are given targets to do things, and when you're not meeting your financial target, you are forced to do things which are not ethical. It's the most disturbing thing nowadays what we come across.
Well pointed out,
So
sir.
at that point of time, you see, a bright student will definitely pinch his conscience, and he doesn't want to continue there. So they're like more than eager to work in a government hospital, because huge number of patients are there, and they are getting the opportunity,
Yes.
and it is satisfying as well, and we are not restricting them from practicing as well.
Yes.
So they are finding it more exciting.
Yes. And the world is changing in
Yeah,
not a very nice way, but good point to think about, sir. So, Karnataka has over 800 nursing colleges.
of course. We see you see, Karnataka is a leader in the field of medical education, not just like that, because of like a lot of forward thinking, or like establishing good institutes. We have more than 800 nursing BSc nursing colleges, and more than 600 diploma nursing colleges. We have more than nearly 200 allied and science colleges, physiotherapy colleges, and nearly 40-50 dental colleges. So indeed, we are leading the country in the field of medical education.
Yes. So, but as a doctor, care isn't just a checklist. I think it's also what's something a good nurse notices that no machine, no file or dashboard ever will. In your experience, in your thinking.
Yeah, you see, this is always the patient care that counts the most. It's, you see, what we do, whether she is doing some procedure, or that's also very important, because you need to have a technical perfect knowledge as well. Apart from that, how they treat the patient, like how they behave with them, is the most important thing. Like, are they making the patients comfortable, or that is the most important thing. So definitely those are the successful nurses who are like better connected to the patients, who sincerely work selflessly. So those are the most successful nurses, and most sought after as well.
Absolutely, sir. And we send nurses to the whole world from Karnataka.
Yeah.
So, what do you have to say for that? I mean, do you
Yeah, you
have
see,
any?
for them, now there is a great demand for nurses across the globe. See, the German Consul General had approached me, and he was telling 50,000 nurses are required in Germany. Similarly, Japanese, Italian. Council General. They are coming and asking nurses in huge numbers. For them, you see, now opportunities are huge. But the only thing is language is a barrier. So I am trying to introduce these foreign languages in my institutes, and also I'm trying to encourage the private colleges as well to give them an option
Okay.
to study one of the languages from the beginning itself, so that they have a better career path.
Yes, sir.
So they have a better pay scale, they have a better life. You see, we should always like think, why not? You see, we are producing doctors not for India, it's for the globe, because Indian doctors are most respected because of the commitment, skill, and compassion.
Yes.
And similarly, nurses. This is required globally, and if you train them well and give them a better language, this thing, then definitely they have a great opportunity.
Yes, sir.
And we should encourage them as well.
Yes. Everyone talks about Children's Hospital in Karnataka, but you built India's first government super specialty one.
You see, yeah, no, there's already, when I took over, you see, super specialty hospital in children care, that Indira Gandhi Institute of Child Health was there before I became a minister.
Okay.
But I upgraded it. It was a 250 bed hospital. We made it a 400 bed hospital. And now I am establishing one in Gulbarga as well.
Okay.
You see, because I always felt concentrating public hospitals in one place, it not be a wise idea. So we need to decentralize. So what I have done is, like, we have established Jaideva in Mysore. We have established Jaideva in Kalburgi, which are functioning now. You see, this Mysore Jaideva hospital is 400 bed hospital, and we are upgrading to 600 because the patient strength is so much now. In Kalburgi last year, I inaugurated 371 bedded Jaideva in Gulbarga. It is now, our OPD is nearly 500 every day. This year I am going to inaugurate in the month of August probably one in Hubli. This is also a 400 bed Jaideva hospital. Apart from this, you see, even in children care, we are establishing one in Gulbarga, Indira Gandhi Institute of Child Health, and also we are strengthening this mother and child hospitals across our medical colleges.
Okay.
We are increasing our NICUs, and we are definitely we are building
Pediatric.
mother and child hospital. Even health department is doing so, but I am also doing one in Gulbarga. Wherever strengthening is required, we are doing that. We are focusing on that because we want to improve our infant mortality rate.
And so, what about aging Karnataka? What about our grandparents?
Yeah, now you see, that is the focus. Now we need to, because even though we have a better demographic advantage than the rest of the other countries, but geriatric care is very important, because after 10 years, after 20 years, our like our aging number of the aged population will be higher. Our demography start declining. We should be better prepared for that. We are definitely establishing and dedicating some beds in medical colleges for geriatric care as well.
Okay, sir.
And even the government of India is also formulating a policy for geriatric care. So we will focus on that. And this is already a big issue in all the Western countries because of the declining demography. Now that's most worrying them now. That is the most biggest challenge they are facing. And India will also face that one time after 15 to 20 years. We should be well prepared by then.
I had an opportunity to chat with Meena Ganesh. So she has this where she sends help to grandparents to their home. They've developed a business model in that.
Yeah, nowadays you see that parent care, many new things are coming up, like they're setting up colonies where everything, all
Communities, yes.
communities,
Yes.
that is a new thing which is like growing.
So, sir, one day every Karnataka may have a digital health record, single digital health record. So, as a doctor and the minister, who should own that file, the hospital, government, or the patient?
You see, ideally it would be better for the patient to have it, but government I would not mind if the government has it as well,
Okay.
because you see, definitely private should not have it.
Mm.
Well, because you see, now data is the most important thing now in future, and because of this advent of artificial intelligence and all, this is definitely going to improvise. So definitely government should have it, or the patient himself should have it. So that is what I feel.
So you're building cancer centers, many cardiac hospitals in every district. But what is your dream as a doctor? Is it more hospitals or fewer patients? And what would Karnataka look if prevention won?
You see, definitely prevention would be the best way.
Yes.
But still, we cannot hope that everything is all right when. But I want my public hospital to be in place as well. That is why we had made it as a policy and made a public announcement that every district in Karnataka will have a government medical colleges. Every district in government will have a super specialty hospital in the government sector, and every district in Karnataka will have a cancer hospital, and every district in Karnataka will have a trauma center. Because these are the four things which will
Need immediate
take off the
attention.
burden,
Yes, sir.
financial burden of a common man. So, and if these public hospitals are there, they will give a competition to the private sector as well. You see, because today Jaydeva is there, we have demonstrated that a stent can be put at 60,000 rupees. If Jaydeva would have not been there, then that the cost of the stent by a private hospital would have been 3 lakh rupees. You go to Hyderabad, you go to Mumbai, you go to any other city. You see, it is costlier because there is no competition by the government. So I am establishing all these public hospitals to make them private sector feel if it can be done at such a low cost in a government hospital, why not the private sector? So that is the intention. We should aim for prevention, but we should always well prepared and don't depend on private sector. But public hospital should be there any eventuality.
So you said only 20,000 of every 1 lakh engineering graduates in Karnataka get a job. If we had a child who was 20 today, what one skill you would tell them to learn tonight? And is AI a threat or a ladder according to you?
You see, this is a very larger question which needs to be answered in a better way. You see, what you are asking is the most relevant question today. You see, when I was a medical education minister in my last term, I knew this department in and out, and I had a clear cut goal set out, and I walked that path. I'm happy about that. But apart from that, the skill development was one of major challenges what I faced, because today the country, the biggest challenge, whether the government of India acknowledges it or not, but what is staring in our face is unemployment. This is the biggest challenge faced by the country today. And why is it so? See, in spite of our so many good engineering colleges, you take an example of Karnataka. Karnataka being so progressive state in the field of professional courses. Even in a state like Karnataka, even though our position is better than compared to rest of the country, why is it that in Karnataka also nearly more than 1 lakh students pass out from engineering colleges, and not and less than 15,000, 20,000 students get placed? So what? So I started analyzing this. So why is it happening so? And what should be the remedy? Because I always believe in solving the problem. I don't only project the problem. If I say something is wrong, I always say with an remedy to it. That is my habit. I know that's my nature. If I say something is wrong, when I was in opposition as well, if I said this government is doing this wrong, I would always suggest what is the right way of doing it without knowing the right way of doing it. If you suggest it, it's only like a slander, it's only like an allegation.
Yes.
We should always have solution. I am a solution oriented man. For that, what we analyzed is myself and my good friend Sudhakar, who was a higher education minister, and Priyank, who was a IT meeting minister. We had a meeting and we deliberated upon this. So to my analysis, what I found was like there needs to be a structural change in our curriculum itself, because you see the way the subjects are being taught in engineering and what the theoretical aspect which is being taught, okay, it's good, but it's not that, but that is not sufficient. For this, to find a solution, we called a meeting of all the industry stakeholders, academicians, and the government officials, and we had a discussion on this. To my surprise, many of the industry partners were telling we do have jobs. There is a huge crunch of human resource. But the students who are coming of the engineering colleges, they are not employable because they don't know the skill what is required by the industry. So there is a huge skill gap,
Yeah.
and we have been we have missed this out, and our curriculum should always be structured with inputs from industrial partners. That is what is required. So we have suggested it to our AICT chairman as well. The restructuring of the entire curriculum and the way of methodology of teaching needs to be changed. Until and unless that is done, this is not going. Why I am telling this is, like, my reasoning is, you see, in skill department, there are two colleges, vocational training ITI colleges are there. We have around 270 government ITI colleges in the state, 270, and nearly around 1900 of sorry, yeah, 1900 aided ITI colleges are there.
Really, sir?
Yeah. So 190 is not 1000, 190 government aided ITI colleges, 270 government ITI colleges, and around more than 700-800 private ITI colleges. When we analyze this, you see these are all vocational training institutes. Here the placement is around 30-40%. And apart from this, we have GDTC college, Government Tool Room Training Centers. This was established in 1970s by Danish government and government of Karnataka. They established GDTCs. These are like long-term diploma courses. These are all diploma courses where they teach tool and die making, mechatronics, electrics, electronics, and these artificial intelligence and machine learning. These are all the 6 courses. To my surprise, there are around 33 GDTC colleges where the placement is 100%.
Okay.
Why then I am like, why is this diploma graduates are getting 100% placement and my engineering graduates are not getting placements? So when we analyzed, you see they are following a methodology where the student is spending 60% of the time in the workshop on the hands-on skill, and
Practical.
only 40% is a theoretical, 30-40% is a theoretical is being taught to him. 3 years he is coming out with a sound technical knowledge with the hands-on skill, and 1 year when he goes for a apprenticeship he get absorbed, and 100% placement is happening. So what I did was to encourage this, we our admission in GDTC were 2500 when I took over. In 1 year I analyzed this and enhanced this to 6000 by convincing the chief minister that starting in these colleges starting more courses. So our admission is 6000. My aim is by the end of the term of this government at least 10,000 students should be admitted. So that will be as good as giving 10,000 jobs every year.
Yes.
So this model should be adopted, and this was confirmed to me when I went to Germany, and I wanted to see this dual system of apprenticeship is well accepted across Europe, especially in Germany. So what methodology they are working on? So went there, and when I saw, you see, they have established this dual apprenticeship training, where the students enrolled there will work in the industry, and the industries they are paying them as well, and they established institute where they will, in for example, in a month they will work 20 days in the factory, 10 days they are taught in this. So this is dual apprenticeship training, and 100% placement happens not only in Germany, across Europe.
And that's
You,
a
if you are done
much
this,
better
so
way of learning
yeah,
also.
and you see that is what adopted in GDTCs. It's a type of dual apprenticeship only, because they are not work, even though they are not working in the factory, they are working in the workshop where the exact conditions under that this thing they are working. So this is the type of education tweaking what is required.
Do you think it's easy to tweak it, sir?
It is, but we'll need support of the government of India, because you see curriculum is by set by government of India. So we need their support in this. But still, you see, the other part of the question is AI. AI is going to play a very important role. But I would take it as not as like they will take away the jobs. Now the way forward should be we should learn it,
Adapt. Yes.
adapt it. Otherwise, we'll be left behind. If you see, luckily, Bangalore, it did not miss. It became Silicon City because we were well ahead in this computer science with so many courses we set up. So students were well trained. Now we need to train. AI is a future thing. We need to train them, and we have already we have made a plan to like train them in at least some important sectors like cybersecurity, problem solving, various other things. We are establishing center of excellence in AI in coordination with NVIDIA. That's what I am planning in skill department, so that in coming next 5 years we should train at least 5 lakh graduates. Five, not only graduates, in any, like if they're diploma holders, whatever short term skilling which is required, we have to create. Because you see, when a data center come to Karnataka, they will, what is the most important thing they look is a talent pool. If we have them, we are ahead of other states, so we should not miss the bus. So for that I am planning to establish center of excellences in Karnataka, and also take the support of the existing engineering colleges and establish a smaller ones there, so that we will train not less than 5 lakh people, enable them in AI in coming days. That's the plan as of now.
So it's truly inspiring, and you're a true problem solver. And I like the way you go into the depth of the problem, going to Germany, having a meeting with all the important, relevant people. Kudos to you, sir. So, sir, after your 2018 defeat, you came back with a 43,000 vote win.
Yeah, yeah, that was, you see, I was like Jila Panchayat member. I was actually 2004, 2008, 2013. I won. I lost in 2018. I was surprised by my loss because I was working selflessly in public interest. But I analyzed why I lost, because probably there was sympathy way, because that the same candidate was contesting against me last three election, he got defeated. So he had a sympathy wave and they gave me a chance. And then when they realized their mistake, they elected me with very thumping majority in 2023.
So, what was the first small thing that turned defeat into a comeback for you, sir?
You see, when I was my this defeat was really surprising to me, because I was uh,
Expecting it.
not expecting it, and nobody expected it in my district as well. But definitely, when I lost, I realized, and people realized. I kept quiet for 2 3 years. I didn't say, because you see, for me, many people said that you should ask for it. I said no. When people have said had not given us opportunity, we should accept it humbly, and we should accept the defeat. This is democracy. This is people's choice, right? So I stayed back. I worked with people, and then you see, we have come in public life to serve the people, not to be in position always. So when you are not position, we should continue our good work. If people realize, they will bring us back.
Yes.
So definitely I was with people all the time. So people thought that I am a better choice, and they re-elected me with thumping majority next time.
Yes, sir. Last question, sir. If you could guarantee only one thing by the time you complete this term, one hospital, one policy, one promise, which one and why that one?
You see, my promise to the state of Karnataka, being a medical education minister for such a long time, what I have told, I have done. So establishing government medical colleges in each district, establishing super specialty hospital in each district, establishing cancer hospital and trauma centers. This might take some time, it might not happen in this coming 2 years, but this I will set a roadmap. It will happen in coming days. That this will be inevitability, because we need to bring an awareness among the people that it's in it's if it is in Gulbarga, why it is not in Raichur. When you see in democracy, only public opinion counts a lot. We need to create that opinion that when Gulbarga, we have made it a health hub today by establishing so many hospitals. As a medical education minister, a long time, we did. I started as a government medical college. I did Jaideva Institute of Cardiology. I started a trauma center. I started a super specialty hospital. Already they are all functioning. Now I have already started. I have laid a foundation for 300 bed Kidwai hospital. 100 bed is already functioning. 200 bed more I'm adding. I am doing one 200 bedded mother and child hospital. I am doing Indira Gandhi Institute of Child Health in Gulbarga. I am doing Nimans like hospital with 100 crores in Gulbarga. I am doing a state of art burns hospital in Gulbarga, which is I'm going to inaugurate in 1 month. I am also doing one critical care other than trauma hospital, which is going to be inaugurated in next 6 months. And also, I am doing one institute of diabetology. These are things I am bringing to Gulbarga to make it sure that Gulbarga will be a health hub. So when this can happen in Gulbarga, it can happen in anywhere else.
Yes.
So and the demand, if it is created, then everybody will ask for it. So that's what we are trying to do.
Thank you very much, sir. You're truly an inspiration, and I've
Okay,
learned so much from you today. Thank you so much.
Thank you.
Today's conversation reminded us that real leadership is about serving people with purpose and ensuring that opportunity reaches everyone. Thank you, Dr. Sharan Prakash Patil, for being with us. If this episode moved you, don't forget to like, share, and subscribe to the New Indian Express. Until we see you next time.